benefits, and after that, we'll chop it up.
All about the money when it comes to job hunting for many Americans. According to a survey from Voya Financial, 72% of people strongly or somewhat agree that they would take a job with a slightly lower salary for better health care and medical coverage. Joining me now is Kristen Kurtich, who is the chief vice president of supplemental products at Voya Financial. I almost gave you a massive upgrade and promotion there. Look,
that works for me.
Look,
yeah.
When people are around me, they just get promotions. That's what I give out, Kristen. All right, so let's talk about this a little bit more here. In the data, you're seeing that people are saying they would likely take better benefits than a bump in pay. Why do you think that is?
Isn't that interesting? So we often pull our consumers just to get insights on their views on benefits and what's provided to them. So this really jumped out at us because to think that someone would actually, value their health care and benefits over a salary is a pretty big deal. And what I think this says to me is that people are feeling the squeeze more than ever in being able to, mitigate those healthcare costs when health events happen. And so salary is important, but having coverage for an unexpected health event is even more important.
What benefits are really being prioritized then in those instances where you're sacrificing perhaps a little bit more in base salary for a better package when it comes to overall compensation, including those benefits?
It's interesting because over the last, decade or so, costs have gradually shifted away from what they were traditionally seen with these PPO plans where the employer was funding a bigger chunk of that. We've seen these high deductible health plans become a lot more prevalent and are offered instead of or alongside of the more traditional PPOs and HMOs. And so I think the naming sometimes gets people when they look at it and see, okay, I'm used to this traditional plan, so I'm willing to pay more each month to have a lower maybe out-of-pocket cost at the doctor. But when you actually look at it in contrast with a high deductible health plan and a health savings account, which are always paired together, it really can be a better financial situation for someone to choose. And so with that cost shifting, coming over to the employees more than ever, I think that's where they feel the squeeze and where they may be missing some opportunity is in really, effectively combining those plans with the health savings account tax advantages.
And so, Kristen, how can Americans know and prioritize certain health benefits, and how do they know that they're making the right selection and opting into the right plans for themselves?
As much as I would love to believe that people wake up with all the energy in the world to enroll in their open enrollment benefits, the average working American spends between 15 and 20 minutes actually choosing these benefits. So what's really great now is more and more of these benefit enrollment platforms are featuring things called decision support tools, or maybe more commonly known as, people like you purchased. And so that can take into account your income, your dependents, even your prior year healthcare spend in some cases, and then make a recommendation. I would encourage people to use those. If that's part of your benefit enrollment, there's the option to skip, but maybe give it a whirl and go through it and see what the algorithm will recommend for you, because it may bring to light some benefits that really weren't on your radar that could be really best for you and your family.
Is there a top benefit that you see employees really prioritizing right now? The one that woos them when they get into a new position and say, oh, you guys offer that. Okay, sounds great. Sign me up.
Voluntary benefits or supplemental health coverage is continuing to grow in popularity. These benefits are not new, but they really were not as prevalent as they have been the last 3 to 5 years. So with products like hospital insurance, critical illness, accidental injury insurance, these are really attractive for people looking at either taking a new job or shifting to a new company. When they see these benefits available, that tells them a lot about how their employer is thinking about their holistic health needs.
Kristen Kurtich, who is the Voya Financial Vice President of Supplemental Products. Kristen, great to
Yeah, so there you go. So the reason I want to talk about this, this is a perfect time because usually around this time, a lot of companies they'll do like their annual benefits enrollment. Like for me, my company started this year. I don't know about you, Ronnie, with Whole Foods. I don't know if they started this year or December. Usually they start around this year. And a lot of companies, they do a benefits enrollment. So, if you want to change, it becomes like health, medical insurance. If you want to have a PPO, HMO, when it comes to like for your teeth, for dental insurance, for me, we have like multiple picks when it comes to dental insurance. Also short-term disability, long-term disability, and all that type of things as well. But there are some companies. I don't know any company. There are some companies that if you want to get some type of pay cut to get better benefits, that's good as well. Or switch to another job to get paid less to get better benefits. And that's what I think a lot of people was doing, because there are some companies, they might pay you as well, but when it comes to a lot of benefits, they might have medical or dental, but they might not have short-term, long-term disability or vision as well. So there's a lot of people that say, hey, even though I might take a pay cut, when it comes to benefits, for me or for my family, wife, kids, whatever, I think, I will, take that pay cut, just have, better benefits for me and my family, all that type of things. So, it's something people to think about. So, go ahead, Akeem. What's your take about some people taking pay cuts to have better benefits, and what's your take on it?
So there's this thing I learned in school called a cost analysis. You have to go down and see how much things are worth and how much it's going to cost you. You can get a job that pays $20 an hour, but the insurance is crap, and there's no, like you say, short-term disability, no HSA, health savings account plan, where they put money. So there's a lot of things you got to look at it. There's some jobs who offer great benefits but low pay. So it all depends. So I do a cost analysis every time I apply for a job. It's okay, how much this is, how far it is, what type of benefits they offer. You know what I mean? So these are the things I see. So they are right and exact. I think a lot of people tend to choose benefits over pay at times. Look, a lot of people who go work for the government or go work for a city municipality. A lot of them don't make money as you think they do. Public Works, Parks and Recs, these people makes a certain amount of money, but the benefits, if they're full-time, health insurance is off the chain. Days off, getting paid for for holidays. So these are the things, just weigh out your options.
Now, but shout out to Ashton Williams, the creator of Shiesty Avenger, is also in the building. Shout out to No Chaser, that's also in the building. Shout out to A Dub, a new subscriber, is also in the building as well. Thank you for tuning in. I love to see new subscriber. And I but shout out to JK's official over there watching us on Instagram. We really do greatly appreciate you, big dog, for tuning in and watching us. I love to see new people that's in the building. You know we have to give you guys a special shout out. Thank you guys so much for always tuning in each and every time we go live. This one was very interesting take. I'm not gonna lie to you, because I didn't expect people to really lower their pay to focus a lot more on their health benefit. Now I understand the reason why now, because health costs is very, very expensive. I think if you don't have no form of insurance, your out of pocket is crazy, a crazy amount of dollars. I understand why people don't want to get raises. They rather get the minute they raise and focus more on their health care. I know, to me, I'm more focused on the money, because I say, the money is very important. Because let's say if the health care is crappy, at least I have the money to at least pay for the resources. Like if I need dental, my dental is crappy, I have money to pay out of pocket to get braces or get aligners or whatever, or get veneers, something like that. So some stuff that healthcare probably won't cover. So, but just to see that interesting how 72% of Americans are lowering their costs and focus more on healthcare is very, very interesting. But healthcare is becoming more expensive each and every day. Even with inflation, it's just making it worse. So I understand right now a lot of people are focused on their health benefit. Like you say, Jordan, earlier on your commentary about how right now it is enrollment. A lot of people are doing stuff that benefit them health wise, see what benefit works for them and their family. So it kind of makes sense. But for me, I will focus on the money. I like, let me get my raise. Let me get my raise now. I don't want to lose that pay, because the cost of living is still going up. Cost of living have not gone down yet. So to the day the cost of living going down, Yeah, I was thinking about my my money. But go ahead, Jordan. Your final.
Yeah, I think personally for me, it's just how the person see themselves when it comes to in the company they work in, and also their career. A lot of people they don't think about be a supervisor or a manager or or a store manager or something like that. So I can see why a lot of people maybe they lower their pay because maybe they're comfortable of their position in their position they're in, and they say, hey, if I work in a position for 30 years, and I have great benefits, I don't want to, risk to get risk to go to another company, get a high paying job, and I don't get benefits for the job I'm working at currently. I'm working at right now, so just how many people feel. Personally, like for me, I'm in the union, so every time, my contract will be up next year. So, when it comes to, health benefits, you see, we can do, do something better with that, with dental, vision, all that type of things. And also, getting a pay raise to that. So working with a union, I get the benefits of all of it, all both, not just, get a higher pay, also, try to get better benefits when it comes to, medical insurance, short-term disability or long-term disability as well. So, but yeah, majority of Americans, they don't want to really move up into the company like that. So I can see why, I understand why you say, hey, I'd rather take a pay cut, just to make sure I'm okay when it comes to medical, when it comes to the medical, or my kids are good, my wife, husband is good. I'm gonna make sure, they're good. So, because anything can happen, car accident, child gets sick, whatever, all that type of stuff for, I don't want to, I don't want to, pay out of pocket, because I know my insurance will cover maybe 70 or 80% of that. And after that, because usually there are people that they want better benefits. If the insurance could cover 80 or 90%, um, usually hospitals or doctors they'll take it, even though you got to pay maybe 10% of it. Some people they just don't pay it at all. They say, hey, whatever, I'm not gonna pay it. Whatever. They'll let it. And the thing is, like sometimes medical bills, it doesn't really affect your credit like that. Like if you owe like credit card bills or mortgage or anything like that or car payments, sometimes most of the time medical bills doesn't affect your credit like that, and that's why some people think it's like if it's not gonna affect my credit like that, I'd rather just continue to have great benefits and won't hit my credit like that. So, but so I can see that's a standpoint of why people would lower their pay just because you're gonna have good medical benefits, and also some medical bills it doesn't affect their credit like that. So I can see that. But for me, I'm all about making more money. I'm with you around. I'm all about making money. If I gotta pay, if hopefully nothing happens to me. If I get real sick, an illness, or anything broken and everything. Hoping nothing happens to me. But I do have the money. If I got paid 30 to 40%, I'll pay that money. Because to me, it's we're in America. It's all about making money, more money, more money. It's not about being stagnant and stay at the same pay. This is America. You can do anything you want to do. When it comes and this is the country of capitalism. It's all about making more money,
Mm-hmm.
more money, more money, and that's what and that's how America is about making more money. So for me, I'm all about making more money, but luckily I'm in the union, so I get both when it comes to better benefits and also pay. So I'm lucky that I'm in that. But for other people, for me, how the average American think. I think the average American should think better to make more money. And once you make more money, you probably could, you could probably um, um, be secure. Also, if you save your money, be more secure. Say, hey, even though I got benefits, I got probably got make 30%. I saved that amount of money. Also, I'm making money, like I pay it out. So I just feel like a lot of Americans should think that way, but unfortunately, a lot of Americans don't. They they a little bit average, and they think about make sure that their benefits good and set up them getting paid more, which I think that's a little bit more important. But hey, it is what it is.